will try my very best to give you an insight of the Bavarian and German perspective on the crisis, how we tried to manage it, and whether we did well, it will be your decision to take. First of all, I mean, if you look at it from a globally point of view, I would say that there's so many different healthcare systems, and it really depends on the healthcare system that's being implemented in a state or in a country, of how the different regions and systems dealt with this pandemic. Our approach, going from a very general point of view to a more specific with regard to digital technology, is that the first step that we took, and for me it's a very decisive step, is that the catastrophic event, the Katastrophenfall, was declared for the state of Bavaria, which hasn't been the case all over Germany, but in some places. So that was a very, very decisive step. Why? Because then we had very, very soon, very suddenly, very resilient structures and very good decision-making structures and power, decision-making power, and also administrative structures that we could use in this crisis. Also, when it comes to the use of digital technology, whereas I have to admit that in the first phase of the crisis, we didn't really have the time to implement new technology. So we really had to focus on the technology that we had in store, that was in place in the different structures in the public health authorities, which wasn't a lot, to be honest. So in the first phase, it was just troubleshooting. We got a lot of good proposals coming in from third parties, but we just didn't have the time and couldn't really use them. Then we had the transition into the second phase, I would say. In the second phase, we started implementing new digital technology where it was instantly needed. Like, for example, the contact tracing software that was needed by the public authorities, by the lower authorities, which wasn't in place yet, but which we had to implement during the crisis. Also, the digital the digital compilation of data from the hospitals, for example. Very important. We didn't have that in place in the very beginning, which was very sad because we were lagging behind on this point. And also, of course, as you showed it, the digital warning app, which was a very important but very small step on the other hand. Now I would say we are in phase 3, so to say, which means we have lessons learned. We are looking into legislative proposals like the Krankenhaus Zukunftsgesetz, the act for the future of hospitals, like the pact for the public health service, and like the newly proposed legislative proposal for the modernization of health and care, in which we try to implement what has proved being successful in the first wave of the pandemic.